Hi, I'm Stephanie from the Note Ninjas, and together with Nicole, the OT, we help PTs, OTs, assistants, and students with treatment ideas and documentation. So today we want to talk about your patients that shuffle when they walk or don't have an increased step length. Instead of always giving the verbal cue, increase step length, increase step length. And we also know we could put, feet down or markers down to increase your step length that way. But another idea is to use an external cue on the walker. So we have a resistance band along the walker, just like this. You could also do this with a rollator. So we would just tie it on there, and instead of shuffling, we will tell our patients to make sure they touch that band. And they're increasing their step length and not always needing those cues on the floor. It also helps, instead of putting the cues on the floor like those markers, our patients are always looking down to make sure that they're stepping onto those markers. Instead, your patients can look up and they are just feeling for the bands, which also keeps better posture, which is really what we want. And then in your notes, you can say, patient presented with shuffling gait pattern. Use external cue on rollator to increase step length. And then you can say how your patient responded. Patient able to increase step length 100% of the time. Patient required 2 verbal cues to make sure they hit the band while walking. Whatever you did and how the patient reacted is what you should do. Remember, this is a great cue. You can even use maybe like a white band, something not as bright as the red, so it blends in a little bit. But instead of using that light on the walker, like I said, those cues on the floor, this really helps, and it can really help make your patients safe around their house or even out in the community. So I hope this tip helped. Make sure to follow the Note Ninjas for more treatment ideas with documentation tips.